Next discussion is the peptic ulcer disease. Solitary mucosal ulcer involving the proximal duodenum in most of the cases, which is 90%, and the distal stomach, which is just 10%. Duodenal ulcer, its etiology is that almost always due to the H. pylori infection in more than 95% of the cases, rarely due to the Zollinger-Ellison syndrome. The clinical feature in the duodenal ulcer is that epigastric pain that improves with the meal, and night pain may occur due to the acer secretion. The pathological finding in this case is that endoscopy may show ulcer with a hypertrophy of the Brenner glands. Common locations are usually in the interior duodenum, and the important complication involve the posterior duodenal ulcer may rupture into the gastroduodenal artery, which will lead to the massive bleeding, and in the pancreas, which will lead to the acute pancreatitis in this case. Increased gastric acid secretion contributes to the duodenal ulcer formation. The next is the gastric ulcer. The etiology is that usually due to the H. pylori around 75% of the cases. Other causes may include the NSAIDs or the bile reflux. Clinical feature include the epigastric pain worsens with the meals, and weight loss may occur because patient avoids eating. Common site in this case is the laser curvature of the antrum. Risk of bleeding from the left gastric artery can be the important complication in this case. Gastric ulcers are more common in older adults compared to the duodenal ulcer. Differential diagnosis of the peptic ulcer. Gastric carcinoma can mimic the gastric ulcer. The duodenal ulcers are almost never malignant, while the gastric ulcers may be the benign peptic ulcer or the malignant ulcer due to the gastric carcinoma. Benign gastric ulcer features small than less than 3 cm, sharply demarcated, and the punched out appearance, radiating mucosal folds. Malignant gastric ulcer features are the large and irregular, heaped up margins, and the biopsy is required for the definitive diagnosis. The next one is the gastric carcinoma, malignant proliferation of the gastric surface epithelial cell, and usually the adenocarcinoma. And there are two main types of the gastric carcinoma. The first one is the intestinal type, and the second one is the diffuse type. In the intestinal type, in the first one is the intestinal type, gastric carcinoma, having the general feature, which is the more common type, forms large, irregular ulcer with a heaped up margins. Common site is the laser curvature of the antrum, and the risk factor in this case is the intestinal metaplasia, H. pylori infection, autoimmune gastritis, nitrosamines in the smoked foods, blood group A. And the pathological concept is that progression usually follows the chronic gastritis, which will lead to the intestinal metaplasia, then the dysplasia, and the carcinoma. More common in elderly males and high risk geographic region like Japan. Diffuse type gastric carcinoma, characterized by the signet ring cell. This is super high yield in this case. The diffuse type gastric carcinoma is characterized by the signet ring cells. Tumors can diffusely infiltrate the stomach wall, and the morphology in this case is the dysplasia causes the thickened rigid stomach wall, which is called the linitis plastica, and this linitis plastica is super high yield point in this section. Important point about that is not associated with H. pylori, not associated with intestinal metaplasia or the nitrosamines. Loss of E. cadherin function contributes to the diffuse spread of the tumor cells. Clinical features of the gastric carcinoma, the common symptoms is the weight loss, abdominal pain, anemia, early stage, and the rare associations are the acanthosis nigricans and the lesser Trillet sign. Lymph node spread, in this case the virchow node spread to the left supraoccipital lymph node, which is known as the virchow node. Distant metastasis, in this case is the first one in the sister Mary Joseph nodule, which means the metastasis to the periumbilical region, more common with the intestinal type. The second is that the Krokenberg tumor, bilateral ovarian metastasis, and the commonly associated with the diffuse type.